Thanks so much, everybody, for hopping on. I'm so excited to share with you my relationship that I have with Dr. Cassie Yang out of sedation and implant dentistry in St. Paul, Minnesota. You know that I do meridian stress assessment here in our office, and almost daily I see a problem on the meridian that affects the jaw and the teeth. And so many times I'm referring people down to see Dr. Yang because she does something in her office called a cone beam scan. And many of you have heard me talk about it, but when we go to our traditional dentist, they're doing a bite wing X-ray, and they're actually not catching some of the things that Dr. Yang can catch on a cone beam scan. So I've asked her to hop on today to share a little bit more about oral health because this is her specialty, not as much mine, and for her to share with us about a cone beam scan and how oral health affects our health overall. So thank you so much, Cassie,
for joining
hi,
everyone.
us. I'm so thankful.
Oh, thank you for having me. So what we do here that's different is, a regular bite wing or X-ray that you would traditionally get at a dental office. It's good to detect cavities, but that's usually what it's good for. But if we're looking for something that's affecting systemically, we want to take a look at the roots, look at the jaw, we need a cone beam scan, and that's three-dimensional. So we can actually look inside of the jaw, and we see things that are typically not detected on a regular two-dimensional X-ray. So we highly encourage anyone who has any chronic degenerative disease to get a cone beam scan, just to rule anything out. So whether we see anything or not, it just really helps us rule that any toxicity is not stemming from the oral cavity.
Yeah, that's a great idea. I know with our GI testing, we see a lot of staph and strep in the GI tract. So, and I've wondered many times if sometimes that's actually coming from some of those potential oral infections that are going on.
There's actually a lot of studies out there, and whether it's like strep or the bacteria that's seen in that causes periodontal disease, the bacteria that's typically found in root canal treated teeth, they found that we swallow those or it enters the bloodstream, and anything that enters the bloodstream will affect us systemically. And so, patients who've been in for heart attacks or stroke, they've aspirated and look at those clots, and it's the same bacteria that's found in the teeth that this patient has. So we know it affects systemically. And so that's why it's always good to look in the oral cavity to see, is this a source of toxicity that's causing our systemic health, that's affecting our systemic health?
Yeah, many times I hear my clients state that, but when I see there's something going on in that meridian for the jaw, they'll say, but I don't have any pain. So how often do you see pain with somebody who has possibly an issue going on with a bacterial infection down in the jaw?
It doesn't always cause pain. And that's why it's good to get a cone beam, because we don't really know something's wrong unless we feel pain. And most of the time, especially if it's a root canal treated tooth, it's already a dead tooth. So the main nerve and blood supply has already been removed. So you're not going to get that pulsating from the tooth. And so it's already a dead tooth. It's going to drain somewhere. So as long as it's draining somewhere, whether that's into your sinus or draining systemically, you're not going to feel pain. And so, we can't associate pain as just being something wrong only. And I always tell patients, like someone who has depression or diabetes, we don't feel pain. And so, we have to just look at a 3-cone beam just to make sure there's no infections. But I actually really like when patients feel pain, and they don't like feeling pain. But when they have a root canal treated tooth, sometimes they will. There's always these nerve that it's still innervated to our body. And it's good that when they do feel pain, that's when they know. But we can't associate that no pain means optimal health.
Yeah, I hear that all the time. It seems our society that we're trained that, well, absence of symptoms means an absence of a problem, but not so much here in the way that the teeth work, because this is a bone is kind of like almost being like in concrete. It hides that infection down in here. So do you mind if I share my screen and share your,
go ahead.
I love that Dr. Cassie uses, I'm going to share the screen here. Hold on one sec. I'm going to share. The report you get from sedation implant dentistry is so nice. It's such a great educational tool, but it's always good to see what's going on. So I'm going to go ahead and let you, I wish I could let you drive. So you let me know what page you want me to be on.
Oh yeah, so this is the summary. So we always present, this is patients come in, we read the scan. It usually takes a couple of days, or sometimes if we're very busy, we'll always tell patients maybe 2 weeks. What we do is it's thousands of slides in this cone beam. So we do take our time reading. So this is what you typically get this is just a summary of the findings. And so then through the pages, it will show you, for example, like if you see anything in green, it means reabscess teeth. But the following page it shows you exactly what we see, and it tells you what the findings, and then summarizes the effects of the findings. For example, abscess tooth, what kind of effects that has on the body, or cavitation, what does that mean? And it highlights any metals in the oral cavity, so especially amalgam fillings. So that's what we typically look for. So a scan, the four main things that we look for are dead teeth or reabscessed root canal treated teeth. We're looking for cavitations. We're looking for more biocompatible materials, so no metals if possible, but again, especially no mercury fillings. And then we look for periodontal disease, because again, everything in the oral cavity drains, it's going to enter our bloodstream. So those are the things we look for. So this is the first page, and then Kimberly, if you go to another page, it just breaks down. So this is the detail of the first page, which is the summary. So like here, it's cavitations, and it just shows like the Hounsfield unit reading of bone density, and that's how we diagnose cavitations. And then just following pages are just, again, focusing on the findings, and then it just relates to the first page of, this is the summary of the first page, but the other pages just gives the detail of the findings.
But this would be a root canal tooth here with the blue lines through it, am I correct?
Yeah, so that the blue line means that's exactly the slice that we're looking at, and that root canal actually looks okay. But then if you scroll down, then you'll see that other root canals, just because one is okay doesn't mean the others are
Right. How
not
about the one right to
reabscessed.
the right of it? Is that got an abscess below it right here?
Nope, so
Is that
that
not?
the left is, that's not, so that's actually the slide that we're looking at. So there's two photos, the one on the left with the blue line, that's the exact tooth that I'm looking at, that's the exact slice.
Okay.
And so then the picture on the right is the slice photo.
Okay.
So we'll put a slice
Gotcha.
photo of it to show that it's actually an okay root canal treated tooth, meaning I don't see that there's a cyst at the end or that there's a pus sitting at the end.
Nice.
But then this one, you can see with the green arrow that whenever we see a shadow around the tip or around a tooth, shadows means the beam can penetrate through. And so that means there's pus or cyst sitting in the jawbone. And we don't want that. So when we start seeing that, we know it's reabscessed. So that's what this picture is showing. This one, it's actually a bad abscess where the entire bone on the lip side has been resorbed and eroded away because the infection is so large, and it's actually impinging on his nerve inside his palate.
Interesting.
So
What kind of symptoms can people have with symptoms? Like, what kind of health issues can they have?
You know, he actually didn't have any symptoms, but so he didn't have any symptoms with his teeth, but he was told by his providers, someone who does exactly what you do, to have a look in his oral cavity.
Yeah.
And so he has heart issues. And so that's why he came in for a cone beam, not expecting to have all these reabscessed root canal treated teeth.
Yeah, people would never associate oral infections with cardiovascular or breast cancer, which are two big things that can come from oral infections that we're not aware of. I know we get a lot of clients, and everybody gets at some point usually has a tooth that goes bad. And what do you recommend for a tooth that goes bad? What kind of options can they do with that tooth?
So if it is a dead tooth or infected tooth, you really just have two options. That's to do a root canal or to get it extracted.
Okay.
So I go over risk and benefits of both to patients that, root canal and the nerve and blood supply gets removed. But I always tell patients, so to me, of true consent is I have to give the risk and benefits, whether I think one is better than the other. But, with the root canal, the good things, you still have that tooth in, but it's a dead tooth. And so, they're cleaning that tooth out as best as they can, but the canal system, it's almost like a cobweb. It's very complicated. It's not just one canal, and that's usually what we clean out, is just the main canal. So you still have these lateral canals that can't be cleaned out. And if it drains and it's still attached to our jawbone, which it is, it will affect the surrounding tissue. And any root canal, we can't clean out the surrounding tissue. We can only clean out that main canal. So that's the risk of root canal, is it's going to, reabscess and drain into our body. With an extraction, though, then now you're losing function. So then you have to consider replacement options. And so most patients want to replace a tooth, and there are different options. You can either get something that's removable, like a partial denture, or you can get an implant, and we do place ceramic implants, and there's a risk and benefits to both as well. So then the replacement is up to the patients on what they want to do. Like some patients want something that they don't have to take in and out, so that would be an implant. Others don't want an implant in their body whatsoever, and so they'll opt for a partial denture.
Nice that they have options, which is great. All right, I will stop sharing this, but I love these reports that you guys give. It's really, really helpful and very beneficial because people get to take those home and they get to review them. Because sometimes, especially if they had no idea something was going on, they're like, wait a minute, I now have, 3 of my root canals are infected. We had no idea this was going on. And it's a little bit for them to process. And I really appreciate the fact that you give them the book. That's, I don't know if you always give it, but the Hidden Epidemic book, which is really educational. To read the book.
We do give it to, we do give it to patients because I do want them to go through it. It is very difficult to lose teeth. I mean, I'm a dentist, I love teeth, right? But
Yeah,
it's a dead tooth, and I want them to get all the resources. And I don't want anyone to, first of all, keep a tooth that's infected and they have to do something. But I also don't want them to regret not taking it out. And so I want to provide them resources and let them make the best decision for themselves. But, I always tell patients too, if you want to heal yourself or you want optimal health or any chronic illnesses that you have to reduce toxicity. And so what we try to do is just present that these are things that are toxic to your body, and then you decide how do you want to proceed and reduce toxicity. So it's very difficult to be optimally healthy if we don't reduce our daily toxic exposure.
Yeah, especially with one of those toxins is sitting in your mouth. So what about teeth?
Yes.
Because we know as we age, a lot of times many of us have had our big molars, they drilled them big and they filled them kind of big. But what happens is a lot of times we'll see that those white teeth turn gray because is that because that metal is starting to leach into those teeth, or does it become unstable over time, or what happens with those fillings with time?
Like with the amalgam fillings?
Yeah, the silver amalgams. Yeah.
Yeah, so those, it's like a tooth is porous, so it kind of sucks in that amalgam too. And so it will turn gray. And then amalgam fillings, they do break over time. And plus the way amalgam fillings are placed, we typically have to make them much bigger than the decay that we saw, just because it's mechanically held in. And so over time it breaks down and it's prepped. So if this is a cusp, it's prepped to undermine that cusp. So over time when you're chewing, it is more prone to breaking. And so when we start seeing fracture lines, we're starting seeing fracture lines that catch with our explorer, or patients starting to have some sensitivity, then at that point in time, even if, no one really, I mean, almost every week I'll hear someone say, I'd rather be doing anything else than being at the dentist. So it's, no one wants to just come in to get those amalgams removed, but there comes a time where you have to replace it or it's going to be a fractured tooth. And when it fractures, we're uncertain how big a fracture it's going to be, if it's even savable at that time. If it fractures too deep into the jawbone, then we're very limited in how we can restore.
Sure. And how do you feel about the new resins that are out? They're not new. I mean, the white resin fillings. I'll be honest with you, I don't know much about them personally.
Yeah, so there's so many different brands. So what we do is we do pick a brand. It's called Vocal Admira, and it's more glass filled than the other very popular brand that is a BPA derivative. So it's more plastic. So what we typically do, unless someone has a lot of allergies and they've had Clifford tests where it specifically tests specific dental materials, if they don't have that, then we typically use Vocal. And again, that's more glass filled. So it's more like a porcelain, although we fill it like a composite. But the material, it doesn't have that BPA derivative.
Okay. That's nice to know. I wasn't aware of that. That's interesting. Well, that's great. Oh, one other question I had is that I had a client come in, she had two different metals in her mouth. What should people be concerned if they have some gold and some silver in their mouth? I'm sure where they could come in contact with each other. What would be a concern with that?
So the more different metals that we have, the more variety that we have, the more what we call oral galvanism. So that it's like a battery effect in the oral cavity. And so then you're going to have more corrosion and more emission. So, gold is not 100% gold. It's mixed with other metals. And depending on the lab, they'll mix it with different metals. Sometimes they even mix it with aluminum and different kinds of metals. And then the amalgam filling, we know it's not just, silver. They call it silver fillings, but we call it an amalgam or mercury, if you want to call it, where it's more, there's a higher percentage of mercury in amalgam. It's almost 50%, whereas silver is just a small percentage. But it's typically called silver fillings. But there's silver, there's mercury, there's copper, zinc, tin, all mixed in, and now you have the gold. So now you really cause more of an oral galvanism. So the least amount of metals, the better. And we know that metals, especially mercury, cause a neurological dysfunction. So I would say if you have metals, if you can remove them safely, that would probably be the best way if you have symptoms already. But there are also tests that you can do to see if you actually have, mercury toxicity or other heavy metal toxicity.
Yeah, we do heavy metal testing, and it's amazing the variety of heavy metals we find. But they do get stuck in tissue sometimes, so it's kind of crazy when we start pushing those metals out. What shows up on our tests when we do a lot of blood and urine testing through our labs, but it's always an interesting. People just don't know, and I didn't even know, even for myself. We just don't know what we're being exposed to. So it's so important for our oral health, because this leads to GI problems, and we see a lot of GI problems because we do a lot of GI testing here. So, is there anything else you think? Good.
Yeah, I was like, I want patients to actually work with you, Kimberly, when they're coming in, because I don't want to just take out these mercury. Yes, it's a source, but then it's been in there for so long, and it has, it's in all our organs. And so when we remove it, someone has to help them detox it out. I'm just removing the daily source, but some patients get very sick from us moving it too fast. And if they're doing their own detox, it may not be the time to do your own detox because you're pulling too fast. And if you're removing it, you're just pulling, they're actually getting more sick. So, patients come in, we always encourage them to please see a provider who can help you detox so that, you're doing it safely and doing it just the right way.
Yeah, there's a lot of misinformation out there that I see. And it's kind of scary if people follow some of those, extreme flushes or really fast detoxes. It really can overwhelm an organ system. So,
Yes.
yeah, well, thank you. And anything else you think is helpful for us to know about our oral health?
I think you cover a lot of things that I would cover with my patients. Again, I just highly encourage anyone who has any chronic illnesses, like get a cone beam, just like you would with your medical provider. That should be a part of like initial examination if you're really trying to heal yourself. It is something to either you will find something or just to rule it out, because a lot of times it does come from the oral cavity.
Yeah. Can you tell me, is a cone beam the same as a cone beam CT? I was chatting with somebody, one of our clients in Florida, and she said they call it a cone beam CT scan down there. Is that the same thing as a cone beam?
Yes, it is. CBCT is usually what they call it, but it's the same. It's three-dimensional, and we can just see things so much better.
Okay, great. Well, I appreciate your time, and thank you for hopping on and sharing your expertise with us. I appreciate partnering with you. I so trust you with my clients, and I see all of them when they come back, and they're all happy. Nobody gets toxic. Nobody ends up having huge issues, which is really big because we have had that problem in the past. So I really appreciate you and what you do and your partnership with us.